Do you get pain in the front of your ankle as you're walking, running, going downstairs, or squatting? If so, this video is for you. I'm Dr. Dave Candy, and in this video, I'm going to explain the various things that can cause pain in the front of the ankle, how serious they are, and some things that you can do to relieve them. Now, before we get started, it is important to go over some anatomy and also some anatomical terms. And I know there are people that like to just get straight to the exercises. I will try to be brief, and I'll also put jump links down in the description, but I would highly encourage you to listen to this because the ankle is really complex, and there are some terms I'm going to be using repeatedly through this video. So hang in with me here for just a few minutes, and then we'll get to the treatment. So your ankle is made up of 4 bones. You have your tibia, your inner leg bone, your fibula, your smaller outer leg bone, and those form the bumps on the outer side and the inner side of your ankle. The medial malleolus on the inner side and the lateral malleolus on the outer side. Now, between those 2 bones, there's sort of a wedge-shaped bone with a dome on top, and that's called the talus. And that joint forms most of the up and down type of motion that you get at your ankle. Now, for the most part, it is just an up and down joint, but there is just a tiny bit of side-to-side motion as well. Most of the side-to-side motion comes from the next joint down below that, the joint between your talus, which again is wedged up in between here, and your calcaneus, your heel bone. And that subtalar joint is responsible for a lot of the inward and outward motion of your ankle, or pronation and supination. Now, the axis of rotation on that is at kind of a 45-degree angle, so the motions of inwards and outwards, they actually occur along all 3 planes. And I'll explain why that's significant a little bit later in the video, but it is kind of important that you know that. Now, another term that you should know are the motions of dorsiflexion, which means pulling the top of your foot closer to your shin, and plantar flexion, which means pointing your toes downwards. And I'll be using the term dorsiflexion, or your shin moving closer to the top of the foot, or vice versa, the top of your foot moving closer to your shin, repeatedly throughout this video. So now that we've gotten over those terms, what causes pain in the front of the ankle? Well, most often that is due to something else, commonly an ankle sprain, or it can be from a fall directly on your foot where the talus gets jammed up into that talocrural joint. And if that happens, the most severe but least common thing that can cause pain in the front of the ankle is either a severe ankle sprain or a fall from a height where you fracture the cartilage and the bone of the talus, which is known as an osteochondral fracture. And that, unfortunately, does often require surgery. But again, you would know if you had done that, you would have a severe traumatic injury that hurts immediately. So now that we've gotten past that, what's the next most severe thing? Well, the next most severe thing either comes from a severe ankle sprain, especially one where you get a hyperdorsiflexion, meaning you go too far into this type of motion. And when you go too far into that type of motion, it jams the talus up between the 2 leg bones, and it can kind of spread them out. And there is actually a joint between your tibia and your fibula, which has a membrane that runs between those 2 bones. And when you get that hyperdorsiflexion mechanism, it jams the talus up between those 2 bones and can spread them out. Now, truly the best treatment for that is to brace it. And usually high ankle sprains, as that's called, take a long time to heal. The most common place that you'll feel it is not right there, but just slightly higher in the ankle. And that is a key difference because with a high ankle sprain, you don't want to stretch in the acute phase. Now, after you've been in a brace for a while, you may need to stretch because you've gotten stiff. But bracing in the short term is the best treatment for a high ankle sprain. Oftentimes an air cast brace that kind of goes around your ankle like a saddle, and then it has straps that compress together to hold your tibia and fibula together, is the best option for that. However, if you have just a lace-up ankle brace, which most people do if they've had an ankle sprain, they'll get them either at their doctor or the ER or just the sporting goods store. But if you have a lace-up brace, try that first. Just put it on pretty tight so it compresses the two bones together. And if that doesn't work for you, then I will put links to both the lace-up brace as well as the air cast brace in the description here. So next, what is the most common but least severe thing that causes pain in the front of the ankle? And that's something called anterior ankle impingement. And what that means is basically you pinch in the front of the joint. The talus is too far forward in that saddle or in that socket. And so as you go more forwards, particularly in things that require your knee going more forwards over your toes, like going downstairs or squatting or running, things that require a little bit more of that movement than just everyday walking. Well, in that case, what you really need to do is get that talus to glide more backwards in the socket. Now, how does that often happen in the first place? Well, when you have a severe ankle sprain, you often sprain a ligament on the side of your ankle called the anterior talofibular ligament. And essentially what that does is it attaches from the fibula to the talus, and it prevents that talus from gliding too far forwards in the talocrural joint. But if you've had a really severe ankle sprain where you've torn that ligament, or you've had many ankle sprains where you've repeatedly stretched it out over time, then that ligament no longer does a good job of holding that ball securely in the socket. And so the talus can creep forwards, and as you go more into this motion, you start to pinch the talus up against the front of the tibia and fibula. So how do you fix that? Well, the quickest, easiest way to fix that is actually seeing a physical therapist or a chiropractor and getting an ankle joint manipulation. And what they do with that is they grasp around your foot and quickly pull on the foot. It kind of gaps the talus from the joint, and it almost instantaneously relieves the pain. And if you are in the St. Louis area, we can do that for you here at the office. But one thing you should know is that once you've done that, it is subject to happening again because you've stretched out the ligaments in your ankle. So if you're having acute pain, I would encourage you to see someone, but it's good to have a way you can do it on your own as well, because it is likely to come back. So how do you do that? Well, you can do that using a towel and putting it around the front of your ankle like this. I'll show it from this view and then as well from a side view. So you put the towel around the front of your ankle and pull backwards on it. And what that does, it kind of helps pull that talus backwards in the socket. And then you go forwards like this into dorsiflexion while pulling backwards with the towel. So bringing the knee more forwards on the toe. It is important that you keep your heel on the chair. So pulling like this and then going more forward. You don't want to allow your heel to come up as you're doing this. Now, if you can't get this range of motion because you have knee pain or hip pain, you can do it on something smaller. You can do it on a stair. You can do it on a lower chair. You can do it on a step stool. Anything that you can get your foot up on. It doesn't have to be quite this much hip and knee bend if you don't have that amount of range of motion available. And while we're talking about lacking range of motion in your hip and your knee, if you have arthritis in your hip and your knee, you can also develop arthritis in your ankle, which will effectively give you that same sort of mechanism of that anterior impingement. And this can help out with that as well. So again, you take the towel, you put it on the front of the ankle and lean forwards. Now, how long to do it? About a minute or so. You don't need to count reps or time it. Just go back and forth in kind of a rocking motion, and that helps restore the normal movement at the ankle joint. Now you can also use a stretching strap like this that's a little finer, and that way you can get a little more specific over the top of the talus or over the front of the talus. A dog leash works pretty well as as well if you have one of those around the house, or to see it from the side like that. So that's the stretching exercise to help get the talus to glide more backwards between the tibia and the fibula. And that does help relieve pain, but like I mentioned, once you've stretched out those ligaments, it is somewhat likely to recur. And why is that? Well, because you actually don't have any muscles that attach to the talus. So there's no way that you can strengthen that talus to pull it backwards in the socket. So what do you do about that? Well, this is where that anatomy part from the beginning comes back in. If you remember, I talked about the subtalar joint, how it has sort of a 45-degree axis. And so you actually get some plantar flexion and dorsiflexion in that joint. And if you've got a stiff talocrural joint, people will often compensate for that by going into pronation, which gives you some dorsiflexion at your subtalar joint. But that's not where it belongs. And so if you are overpronating and getting too much motion like that, you're not getting that talus to glide back in the socket regularly. And so it makes it more likely that you'll get that anterior impingement when you require more than the usual amount of dorsiflexion. So given that there's no muscles that pull the talus back into the socket, the next best thing you can do is prevent overpronation at that subtalar joint so that you're regularly getting that talus to glide backwards in the socket. And so to do that, stand with your arch domed, arch lifted like that, and then just practice balancing on one leg, keeping that arch lifted. You don't want to allow your foot to flatten or pronate because then you're encouraging subtalar dorsiflexion. And what we really want to do is practice talocrural dorsiflexion. Now, once you've mastered standing on one leg with your arch lifted, then you can start to do little one-legged activities, for example, like going downstairs, where you're trying to keep the arch domed and keep that subtalar joint from pronating. So you're getting talocrural dorsiflexion here because you're not allowing subtalar pronation, which includes dorsiflexion. So hopefully you found this video helpful if you are having pain in the front of your ankle. Now, if you're watching this from the St. Louis area, like I mentioned, there are some really effective in-person treatments that we can do for you here at More for Life. So just reach out and we'd be happy to help. And no matter where you're watching this from, if you found this video helpful, give it a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching, and I'll see you in the next video.